Welcome to today's event, Making an Impact on the Global Stage, behind the scenes at the United Nations General Assembly, brought to you by Results Development Office. I'm Melissa Strobel, Results Director of Development. Our presenters will be joining us shortly. Before we start, we have a few tips for this webinar. If you have any problems or need assistance with Zoom, please use the chat function to connect with our staff. You're welcome to ask questions at any point using the Q&A function at the bottom of your Zoom window. Our presenters will answer questions in the second half of the webinar. Closed captioning is available by pressing the CC at the bottom of your screen. This event is being recorded. We will share the link in a follow-up email. In just a moment, please welcome Results' Executive Director, Joanne Carter.
Hi, everyone. For those of you that, can you hear me? Yeah. For those of you who don't know me, I'm Joanne Carter, Executive Director of Results, and a big welcome to today's special event. I'm joining you from London, and I am so grateful to be with all of you. I'm really excited to share a behind-the-scenes look at our impact leading up to and through key moments last month when the world leaders came together in New York for meetings at the UN General Assembly of the United Nations. And I was so honored to represent Results along with colleagues at the UN in New York and to see the impact of our work, really the amazing grassroots mobilization of Congress in advance of those UN meetings, and also the high-level relationships we've cultivated over years to bring new leadership and global leaders to support tuberculosis efforts in their own countries and globally. And most importantly, what this has and will mean in lives saved and suffering averted. But before we dive in, I do just want to say how immensely grateful I am to all of you for your generosity and your partnership that makes all of Results work possible. You know, your resources provide key support for the remarkable grassroots network and for helping bring in new grassroots, for supporting lobbying efforts, for opportunities for us to innovate, for support across the organization that is really the platform to make all of the work possible. And honestly, your support leverages like tenfold or more foundation support. And everything you're going to hear about today was supported and made possible by your generosity. So as Melissa said, we welcome you to post your questions in the Q&A at any time, and we will save the last 15 minutes to answer as many as we can. Now I also want to bring on to the screen Colin Puzo Smith, Results Director of Global Policy. Colin drives, welcome Colin. Colin drives our global work on health, nutrition, education. He's been at Results for a decade now, and I know some of you know him, and previously he led our work on communications and grassroots expansion. And we're really thrilled to have him in this Director of Global Policy role. I really appreciate his leadership and smart work this year in shaping our campaigns to increase access to health, education, nutrition, and especially for the most impoverished and marginalized. And also our newest campaign that we're rolling out to influence the World Bank's funding for critical development programs. And I'll actually be heading to Morocco on Saturday for the World Bank's annual meetings, and we will be sure to update you on that in the future. So Colin, over to you.
Yeah, hi everybody. It's really wonderful to be with you all. And just wanted to start by echoing Joanne's thanks. I really love my job and excited to share a bit about our time in New York last week. But as I was thinking about getting ready for this, you know, so much of what we got to do in New York was the culmination of months and years of work, as Joanne was saying, and I felt lucky to get to be there, but it's only possible because of all of your support, as well as the action many of you take. And so in a second here, what we have on deck, our development team and creative team put together some video that we'll play in a minute. These are cell phone videos and pictures some of our staff grabbed, and they're slowed way down just to give a sense of what things look like. We know that a lot of the work we do in the policymaking process can feel kind of abstract, so we wanted to put some visuals to it. But just to say, this is the raw iPhone version, not the Oscar-winning version. But that's coming up in a second. But before that, back to you, Joanne, maybe to ground us a bit in why this year matters so much on TB in particular.
Yeah, I mean, I think really thinking about, in the context for TB, like maybe a little bit of history too, about our work on TB, and that this year can be an inflection point for tuberculosis. And we have the opportunity, again, building on years of support to actually make that happen. And I think for me, a little bit of the context of that, especially for people that are new here, is that TB is a huge cause as well as a consequence of poverty. Nearly half of people with TB face catastrophic costs as a result of getting sick. Affects their whole families. Kids are orphaned. Parents can't work. And we actually started working on TB as a poverty issue and an issue of inequity. And TB has resumed its place as the most deadly infectious killer in the world, and that's despite being curable. And this is clearly a failure of political priority mostly because of who becomes sick and who dies of tuberculosis. And we have worked for decades to change that. And just again, for some context, when Results started working with champions in Congress on tuberculosis in the late 1990s, TB funding was $1 million a year, just for some vaccines that don't work very well. They protect young kids. This past year, it was $394 million. And the head of our health agency, U.S. Agency for International Development, said something in New York that completely blew my mind, which is that since USAID started investing in TB in a meaningful way over the last 24 plus years, driven by the advocacy of Results working with Congress, the U.S. has invested $4.7 billion for tuberculosis. And that, again, that was us and champions in Congress. And when this year started, we saw, the biggest opportunity in decades, new treatment breakthroughs, potentially a vaccine on the way, bold plans from countries like India, TB legislation that Results has been working on, that some of you have been working on, and that Colin will say more about later, and real also moving and inspiring ambition and resilience from countries with high burdens of TB. In 2020 and 2021, there were huge setbacks in progress to TB because of COVID. But the TB programs that we helped countries build actually responded with resilience and have shown real ambition, not just in clawing back progress, but actually in advancing it further. So that 2022 is going to be the best year ever for diagnosing and treating people with TB. But if we don't sustain that momentum, then countries are going to lose that ambition and the ability to continue to rocket that progress forward. And that's why we needed to seize this moment at the United Nations high-level meeting on TB in New York and all that surrounded it. But now, Colin, maybe if I could, ask you to say a little bit about, our volunteer advocates and staff did amazing work in the lead up to the events in New York City. So can you just say some about that for folks that aren't as familiar?
So we set out this year with really 3 goals for what we wanted to see the U.S. government do to seize the opportunities Joanne was just talking about. So those 3 goals was 1, to further boost funding on top of what you just mentioned. 2 is pass the End Tuberculosis Now Act, which is a piece of legislation that we worked with members of Congress to draft and create, and have worked with grassroots across the country to build really deep bipartisan support on. And we won't say a lot about that today, but it would really strengthen USAID's programs and cement a lot of the things that we'll talk about in the next few minutes. And happy to come back to that for folks who are curious. So boost funding, pass this legislation. And then the third big area, which is what I want to spend the most time, is getting the US government to bring a bold plan to the UN meeting that happened this fall, and to encourage other governments to do the same. So, on that first goal around funding, every year since that, when that number was at 1 million, as Joanne was just saying, we've worked in the annual federal spending process, appropriations, and many of our volunteers who are also on the line today know this process very intimately, working really deep in the weeds with congressional offices. And not just over time have we brought that number up, but each of the last 5 years, we have secured an increase to this funding line for tuberculosis, including at the end of last year, unlocking another $32.5 million. And we can talk about sort of specifically what that meant coming into this year. And maybe as a quick aside, it's not exactly good news, but there's a really interesting lesson. Right before the drama of this week on Capitol Hill, the House passed its foreign aid spending bill. And overall, this was not a good piece of legislation. It had really bad cuts to important foreign aid programs. But tuberculosis in particular, despite billions of cuts to the overall program, tuberculosis was protected. And we're going to make sure it stays that way. And what I really want to focus on for a minute here before we turn to the UN itself was that third goal of pushing the administration to show leadership. And the way we did that initially is we set out with leaders in Congress to write a letter to President Biden about this UN meeting and how we wanted the US to show up. And then our grassroots, again, many on the phone, and I actually see folks from the districts of the key leaders in Florida, in Texas, others who led on this letter. But our grassroots across the country worked to get members of Congress to sign on. So in the end, well over 100 members of the House, both parties, every region of the country. And right as we were doing this, the US government had representatives that were in New York at the UN in the early stages of negotiations around what would be the outcomes of this high-level meeting. So they were working on a declaration that every country would eventually sign on to. And that gets drafted over a series of months, passed back and forth with country governments around the world. There are a lot of people involved. And so as grassroots, we're really pulling out all the stops to get members of Congress onto this letter. We were feeding versions of that letter in real time to the negotiators. So, 50 signers, 60 signers, 70 signers, sort of day after day as those numbers ticked up. And without going into the details, these negotiations at the UN this year got very ugly and deeply political for geopolitical reasons that have nothing to do with tuberculosis. But we were able to show to the US negotiators there and other supportive governments that Congress had their back. And so, we're using it in the negotiation process, but then also when the letter wrapped up, we had the full list of signers. The congressional leads sent it straight to the White House. And then as results, we sent it to the State Department, to USAID, which is our country's main agency focused on TB, to the National Security Council, the Department of Health and Human Services, all of the parts of the US government that were working together, not just on the declaration that I mentioned, but we're in the midst of deciding if and what else they might announce at the meeting. And then when we were done in the House, we turned around and did it in the Senate. And got a full third of the Senate signed on, again, because of grassroots constituents pushing to get their members of the Senate signed on to this letter. And then reinforcing that with, I don't have the count in front of me, but dozens of pieces of media, events on Capitol Hill, more meetings with members of Congress, moving forward the NTB Now Act, the legislation we were talking about. And we'll turn to the UN in a second here, but just one anecdote. It was the week right before everyone was converging on the UN. We met with a senior leader in the Biden administration who oversees a long list of global issues. And she said that the thing she was most excited about for the week ahead with her full portfolio was what the administration had in store on TB. And she shared that with us because she knew the role that this network had played in making some of that possible. So I think that gets us to the week in September. So maybe Leslie, I think we could run the video. And maybe just to set the stage a little bit. So the UN General Assembly, this is the main policymaking arm of the UN. And it brings together the heads of state from close to 200 country governments each year in September. So President Biden and all his peers. And they come with them, 200 security teams and logistic experts. You just saw the motorcade going by, not sure who was in that one. I live, and right now I'm about half a mile from the White House, but I will say it does not hold a candle to UNGA week in New York in terms of motorcades and security lines. But also with those heads of state come ministers and policy advisors and members of Congress. And it is really the one time of year when all those folks are in the same place, which means also comes the media in every language and every continent. This is a picture right outside the UN headquarters where in an hour or two, you saw folks broadcasting live at prime time in each of their country markets. And advocates like us. And on the agenda for this week is everything that affects the world. So conflict, climate change, geopolitics, and the full range of poverty issues that we at Results care about. For those who are familiar with the Sustainable Development Goals, you can see this wheel here that has them all listed with good health and well-being right at the center, knowing the focus on health. And here, this is right inside the entrance to the UN. For any eagle-eyed editors, if it makes you makes me feel better, you might have spotted the typo in the sign there. Even the UN makes typos, but that's why we were all there. Many of you know about the Action Partnership. This is a network of advocacy organizations, which includes Results, spread across 5 continents. And as Results here, we host the coordinating body for action, so supporting partners around the world in their advocacy. We have a shared mission and shared values, and we build campaigns together, but each of the action partners is its own locally rooted advocacy organization. And so you'll see a handful of those partners in these slides ticking by from Canada, from Cote d'Ivoire, UK, in Ethiopia. We'll see a handful of those folks in some of these pictures. And keep an eye out as well for lots of Results friends and former webinar speakers and others. But one of the perspectives that's often excluded at these kinds of UN events are people and communities with firsthand experience of these issues. And that expertise and the exclusion of that expertise has really for a long time been a problem in global policymaking circles. But TB is one area where I'm really proud that, and to be clear, there's a huge amount of work still left to do, but this is an area where folks with lived expertise, people who have survived the disease themselves, their family members, community health workers, were really out front this week and leading in the TB response overall. We're on this photo of folks in Times Square, so I think this is the one time of year where you have wonky messages about pricing on TB tests and treatment alongside like ads for Hamilton and the Gap. And maybe we can keep going a little bit. Alongside these kinds of events, there are in the sort of official agenda at the UN, there are just an enormous number of side events and panels and meetings and protests, including a lot of the issues that we care about. And a lot of those are not things that are grabbing the headlines this year or even front and center at the UN itself, but are part of laying the groundwork for the future. So right now, for example, we are working to set up successful nutrition and education global pledging moments for the next 2 years. And so that was part of what we were focused on the sidelines of the formal UN agenda now. A second ago, you saw on the screen that was talking at the podium was former President Kikwete of Tanzania. He himself is a champion on both nutrition and education. That was an event focused on one of our core priorities within education, which is the foundational learning that kids receive. This is another of my colleagues, Salam, presenting on new TB research, and we can keep going from here. It's these kinds of events that happen on the sidelines, and yes, our panel discussions, you know, but we'll talk about what comes from these. And one of the things that I was recalling this year was actually in the space again, where it was on the sidelines of the UN General Assembly last year, where we really kicked off the process toward this year's high-level meeting. And you can see Joanne moderating another panel on the screen here. This one actually is focused on tuberculosis, with senior folks from the head of the Africa CDC, senior folks from Gavi, the Vaccine Alliance, from the Gates Foundation's arm that does research and development, with a panel of experts on some of these issues. And I'll hand it over to Joanne in just a minute to talk about what came from some of these side events, but maybe just to fast forward a little about what we are sort of looking forward to at this point. At the end of this week is when the high-level meeting was going to happen. So getting ready to see TB taking over two of the big multi-story UN chambers, first with all of the countries signing on to a political declaration, the one we were talking about, and then saying one by one, taking the stage, every single country essentially on the planet having a chance to come to the mic and talk about tuberculosis. So we had 8 hours of these interventions. And we can talk about why those matter. But before that, this full week in New York City, and we can keep going on the video, these events, one of the things we were doing was taking that congressional letter and talking face-to-face with ministers of health, members of parliament, US government representatives, and handing them this letter. And now, you know, no one was like reading it line by line, walking down Fifth Avenue, but you could see folks' eyes widen because this is the front page of it, but you open it up and there's a page of signatures, and then another page of signatures, and then another page of signatures, and then another, each from a member of Congress.
And that was totally what blew their minds, is seeing those signatures that the grassroots gathered. Can I just say, Colin, one thing that really struck me too, like there were some people, like including from ministries of health or government officials, that I handed this to, and they already knew about it. So this thing, it's kind of like we were handing them out, but it had also permeated, like other people handed them, and it wasn't, you know, there was only a few of us there from Results in the US. So people knew about this. And so just to say, like, the stuff that we were doing was meant particularly to focus on the administration, but it had impact beyond that, from what we were doing and from what other people had shared. So that was very moving to me, that people knew about it sometimes when I handed it to them already.
Exactly. You want to pick up on the Coalition of TB Leaders?
Yeah, what I want to say, like you made a point that, you know, there is this, that's the Vice Minister of a really amazing woman, Vice Minister of Health of Brazil, Women in Bread, that I was hugging there. And, you know, the headline events were often the high level, you know, was to be the high level meeting, but some of the stuff on the side was even more powerful. And one of the biggest was this launch of a coalition of TB leaders, like heads of state who were represented in this particular meeting, often by their ministers of health. We worked with the Stop TB, the global partnership, Stop TB partnership, to come up with this idea of creating this coalition of leaders. We launched it with them in India in March with Prime Minister Modi of India. And then it was amazing to see this thing come to fruition at this event in New York City. That's the Minister of Health, really dynamic guy, Minister of Health of Indonesia. So Indonesia, Brazil, it's going to lead the G20 next year, Kazakhstan, Tanzania, Kenya and others stepping up to sort of be part of this coalition of leaders and with their own ambitious work, but also being willing to push this regionally and globally. And that was one of the, it's not lip service, it's like real stuff. This woman in Brazil was amazing. You know, they're going to host the G20 next year. The president of Brazil is committed to ending poverty and hunger in Brazil, but also to health for all. And they see TB as a poverty issue, and they really want to drive it. So it was really exciting and inspiring to see that. And this is what we need. If this is really a political, more of a political barrier than a technical one, then that's what we need, is this kind of high level political commitment. And that's really why I was so moved by that event. And I also, if we want to keep going through video, I was also, we also attended in parts of Barb Weber, who leads our VP for philanthropy, and also one of our board members, Ashish Bali. I don't know if Ashish is on, but a really big thank you to Ashish. He's here with the head of the Global Stop TB Partnership. So he was at Concordia, and Ashish has been behind the scenes working with high-level folks in the Indian diaspora community and lots of others to help drive the TB issues. So, I mean, we used like every opportunity we had during this weekend with high-level folks in town to actually really make this happen.
Yeah. And this video is from another event. This one focused on TB prevention in particular. And again, you know, the purpose of these events isn't just the cocktail party, right? So here we heard from TB survivors and community leaders from ministries of health. You saw on stage just a second ago there, leaders from Indonesia, Nigeria, Romania, and Brazil about the tremendous work they're leading, but also about the challenge, which is funding on TB, all parts of TB, but in this case, talking about TB prevention. And right after that, another panel came up on stage, and the moderator was pretty direct and looked, because this next panel was all government donors, global institutions. The moderator looked at them and said, okay, we just heard about the challenge. What are you going to do about it? And often in those moments, right, we see politicians kind of like squirm and deflect. But our head of global health at USAID had an answer. This is him on screen with Joanne, Dr. Atul Gawande. And what Atul had to announce that day was exactly the kind of thing we had been pushing for. So USAID had been working to negotiate a price reduction for the treatment that is used to prevent people from getting sick with TB. And what that price reduction means is that with just the money the US already had set aside for this, they would be able to support an additional 750,000 people to access this life-saving treatment. And that is to say nothing of future funding, what support from other donors could do, how country governments would now be able to access this treatment at that lower price. But part of what I'm really struck by with this is that the way this actually happened is incredibly technical and wonky. And indulge me for a second. So what USAID did, they worked with researchers to rework the way that the drug itself is literally made, like the raw drug substance. Then once they had that new lower cost, more reliable way to do it, sort of in a lab somewhere, they negotiated a manufacturing license with a manufacturer in sub-Saharan Africa. They haven't actually announced which country because the paperwork isn't done, with a manufacturer who could make the drug at that lower cost using that simpler technology, and then produce it regionally closer to where it's going to be used. And I emphasize that because of the technical details of that, from the scientific piece to the pricing negotiations to the logistics of technology transfer. These are the kinds of things that don't normally get noticed by Congress or anyone in the US voting public, right? But they are what USAID is focused on. And so when we are able to generate strong congressional support on something like this, it says to USAID, you know, that really hard, complex thing you want to do that doesn't necessarily feel like it has political backing or urgency, when there are a million other crises, well, we've got your back, and we're able to show that from Congress. And so this prevention announcement was just one of, I think, 6 announcements like it from USAID this week. So there was another price reduction on drug-resistant TB treatment. And again, price reduction, that feels kind of abstract. But it's not just that it's cheaper for a person paying to access it. It is that these are treatments that government budgets are already paying for, which means, so oversimplifying a little bit, for as many people as the budget currently covers, if you keep the budget the same, but cut the price in half, you can now treat twice as many people. And again, that's a bit of an oversimplification, but that's why a price reduction matters so much. And we saw the same thing on price reduction that USAID helped negotiate with other global partners on the highest quality testing, brought down the price of that by 30%. They announced a new research trial that they're doing that could be game-changing for treatment. They announced a new pool of incentive funding, essentially rewarding countries with the boldest, most ambitious plans. So these were the kinds of things that congressional support helped encourage USAID to do. And one of the things they said each time they made one of these announcements is the reason we are able to do this is because we got an extra $32.5 million from Congress at the end of last year.
Yep.
So that additional money isn't just like going into a big pot. They are actually using it to do something real. So Joanne, I'll hand it back over to you to take us the HLM itself.
Yeah, and I would just say the other thing that blew my mind was that the U.S. was really so I mean, it was all of those announcements, but the U.S. was so present and leading every single day. So there we are outside the with our colleague Salam and also our colleague from Cote d'Ivoire, getting ready to go, or maybe we just come out part of that day. But so for the UN high-level meeting day itself, Colin described, kind of what happens. It's hours and hours where, representatives from all these countries come together to make announcements, make commitments. Who is there? Lots of advocates that were loud and inspiring, and we'll say more about that at the end. So TB advocates, we were kind of what you call civil society. We're kind of in the back of the room, and but very present and very vocal in a very positive way. Like, it was the most energetic of the high-level meetings, and that's what everybody said. And it created a sense of we can do this. So anyway, as we move forward, the president of the General Assembly, Dennis Francis, who's from Trinidad and Tobago, he started out by saying, why, after all the progress we have made from sending a man to the moon to bringing the world to our fingertips, have we been unable to defeat a preventable but curable disease that kills over 4,400 people a day? And I was also moved that the Deputy Secretary General shared her personal story. I mean, her commitment to this issue of losing her father to tuberculosis 37 years ago that week. And really also said, let's end tuberculosis now. So there was really that momentum there, and folks, from over 120 countries, made commitments there as well. And I just wanted to kind of say what Colin said as well. It was difficult months to really get a bold set of commitments in the resolution, with targets for the next 5 years. That was really tough negotiation. And even at the end, we didn't even know, again, because of geopolitical stuff, whether these resolutions were going to be taken up at the high-level meeting. So it was a really important time, but a bit of a fraught one, to be honest, and a bit nerve-wracking. And civil society also had a chance to give input in these things. And civil society meaning not governments, not private sector, but folks from communities. And that's our colleague Salam. So when that chance is made, she got a chance to speak. She spoke really powerfully about, maybe one of the most important things to say that day is, like, TB is more of a political problem than a medical one, and that's how we have to tackle it. And that was really powerful, and had a chance to do that. Colin, I don't know if you want to say anything about the announcement that the U.S. made there.
Yeah, so the U.S. took the stage, it was really
Dr. Tedros, right?
yeah. Many folks know Dr. Tedros from a long partnership with Results. Yeah, so the US, Dr. Gwande, who we saw before, got on stage and reaffirmed all of the things that the US had announced throughout the week. And then we also had a representative, the Assistant Secretary for Global Affairs at the Department of Health and Human Services, who is also a longtime former civil society partner of Results and is now a senior leader at the agency, Lois Pace, who delivered the official intervention on behalf of the US government, who we had seen her the night before, and it was clear just how moved she was by this experience on TB and the opportunity to get to play that kind of senior leadership role on this issue in New York. And she talked really powerfully about how the US government sees TB as a poverty and an equity issue. And there are, lots of reasons that, a country could or should be focused on TB. And I was really proud in that moment to hear her talking about the poverty and equity foundation of this problem, and why tackling it with that as the priority is so essential to the strategy.
That's great. And Dr. Tedros had earlier in the year launched, both with support from us directly, and had launched the WHO, the Director General strategy on this, as well as a coalition of leadership to support vaccine delivery. And then I just want to say our partners, maybe just pause it for 1 second, if you can. Our partners in Africa worked with their governments. So our partners in Kenya and Tanzania and elsewhere, but worked with their own governments and allies in the country to build political support and ambition for their countries. And in particular, Tanzania and Kenya, they shared like really dramatic reductions in TB deaths. Like the Minister of Health of Tanzania, who you just saw, talked about reducing the number of cases by 32% over 6 years and deaths by 55%. And the Cabinet Secretary for Health for Kenya talked about a 42% reduction in TB mortality despite the pandemic. So that was really inspiring. And then we can say more later, but not only us, but the UK and Canada made commitments, and those are inspiring. And then others like throughout the day stepped forward to make specific commitments, and we can kind of, so we're seeing governments come forward, and a lot of it was what they were doing domestically. And again, some of that made possible by international support from the Global Fund, from the US government and others, and by domestic investments as well. And maybe just here again, the President of the General Assembly, the final outcome of the event was that the resolution was taken forward, and there was a global commitment launched to reach 45 million people with treatment by 2027, which means essentially about reaching everybody with quality diagnosis and treatment. And this is such an important target for ending this disease, but for equity in this disease. And I think the President of the General Assembly was I think quite moved and inspired by the chanting. And in the end, he was actually, we could probably start the video again, but he was actually yelling, "Yes, we can end TB," and kind of encouraging everyone else to keep chanting, because again, I think he was actually moved by it and committed by it. So he was kind of calling on all of us to be doing that again, as we close this out. And it is possible for us to actually track, and part of the work that we will be doing going forward is ensuring not only that we have the resources in the world to do this and to help countries be ambitious, but also that this, countries now have the data systems that we can track this by country and literally by district, to see if countries are reaching these folks. And this is a politically actionable target to reach everybody that people can be held accountable for and make success on, and see where the challenges are day by day and month by month to drive this forward. And maybe I'll just close by, we can close this sort of segment by saying we had afterwards, which some of you who are part of the grassroots network, we had a congressional an event on Capitol Hill that was really a report back the administration. So we had folks from, again, Atul Gawande from USAID and folks from the Centers for Disease Control and Health and Human Services, as well as a wonderful leader who is leading on this work in Indonesia, reporting back to folks on Capitol Hill, to staff, so they could report to their bosses about those letters that they had sent and what the US government had done and was doing going forward. And I got a chance to moderate that, which was great. And it was ended by this wonderful TB advocate and TB survivor, Ria Lobo, who reminded us again about how much US leadership matters in this, and how much the work of US Congress mattered. So maybe we can stop there and open it up to your questions, comments. And I know we had some, pre-submitted questions, so maybe turn it back to the team to just go forward with the questions.
Thank you, Joanne, and thank you, Colin. And thanks to our guests who've submitted questions already. Please feel free to continue submitting your questions in the Q&A. Our first question for the day: what's next for results work in TB?
I mean, Colin, let's both answer that one. I could start. For me, I think it is, how do we help support sustaining country ambition on this? So that is support for, the continued support for TB funding from the US government, directly from the support that we provide to the Global Fund to fight AIDS, TB, and malaria. How do we sustain that? How do we support, through our work and our partners' work, this coalition of country leaders to drive this? How do we help use them to create global attention on this every year and accountability? And then I think there's really exciting continued opportunities building on what the US did. How do we scale up access to treatment and access to the best technology for everybody, and continue to reduce the prices of diagnostics and drugs, and also support development of vaccines? But Colin, what else would you say to that?
Yeah, I mean, and maybe just building a little on that. One of the things, this is the second UN high-level meeting on tuberculosis. The first was in 2018, and if you chart US funding for TB, Joanne took us back to 2019, or sorry, to 1999, another 20 years. But if you look at the period from right before the 2018 high-level meeting, so 2013, 14, 15, 16, 17, the funding is essentially flat. And then you have the high-level meeting on tuberculosis in 2018, and then suddenly the line starts to go like this. So what's flat suddenly starts going up and up and up. And we've added close to $150 million annually since the 2018 high-level meeting. And it is not because of the high-level meeting in a technical sense, but that is what generating political support at moments like this then allows us to go back and do, because we were able to go back to members of Congress who had done things like sign on to a letter to the administration at that time and say, hey, you just signed on to a letter to the administration, how about you fight for more funding? So it opens up new doors for us to do that again going into next year. And then the other two things, and Joanne referenced this as well, but getting the NTB Now Act passed, signed into law.
Yep.
USAID is excited about this ambition, and this legislation would cement that as a permanent requirement of USAID's programs. And then, the really exciting opportunity about Brazil hosting the next G20.
Yep.
We have this history of the last 3 years, 3 countries hosting the G20 with really major tuberculosis burdens and really big, bold leadership, as Joanne was saying, with Indonesia, then India, and now Brazil, and seeing what that bold leadership can look like, and figuring out what we can do as advocates in the United States to make sure the US is backing up that country leadership.
Thank you. Next question from Cynthia Shample. Any new big pledges that give you hope of filling the funding gap for TB global work?
I mean, I'd start and Colin jump in. I think there were pledges. I think some of the most exciting stuff is the degree in which countries are putting this in their domestic budgets as well. Or in the case of Indonesia, they worked with the Global Fund to Fight AIDS, Tuberculosis, and Malaria and the World Bank, and they figured out how to get a very low interest loan and invested over $300 million to help the scale up along with their other domestic funding in TB programs. So some of it is really happening with ambition at country level and using these international tools, mechanisms to help find more resources for them in creative new ways. The Global Fund itself, that many of us have worked on for so many years, is also trying to figure out how to use more of its funding that wasn't fully spent on COVID to help build health systems, with TB as a big part of that. So those are big pushes, and those were, talked about at the high-level meeting. I think also Canada made a new multi-year pledge of around $25 million to TB Reach, which is a global program that's designed to help reach the most marginalized communities and create new strategies that can then be taken to massive scale. And the UK also announced a big package of global health research, and that included a particular contribution to the TB Alliance that works on new and more effective and shorter acting drugs for TB. So those are just a few of them. Anything else I'm missing, Colin?
Two small additions. One, we also anticipate an announcement from Australia in the next month or two, not a major one, but a one that exists on TB in particular. And the other thing, and Joanne, you mentioned this, but just to give a little bit of an example on the ways that countries have really smartly and boldly used, in particular, money that became available to respond to COVID-19 for scaling up access to TB. So like Nigeria as a really great example of that. They got a big investment of external financing to fight COVID-19. And the way they used it was because, right, like if you can test for TB, you can test for COVID-19 essentially at the same time on the same machine. So they used those resources appropriately to scale up their response to COVID-19. But one of the outcomes from that is in the last 3 years, they have scaled up the number of clinics across the country. And Nigeria is a big country with a lot of people. The number of health clinics that now offer tuberculosis testing and therefore connection to treatment has gone up by something like 40%. The number of testing machines in the country has gone up by something like 20%. And that none of that was through sort of TB specific funding initially. It was that they used smart pandemic preparedness investments or at that moment, pandemic response investments, to do things that supported both, and then could sort of leverage TB specific investment on top of that. And so there's a lot to be figured out. And I don't know that all the momentum is in the right direction on this, but the more that there are external financing for pandemic preparedness, I think the more opportunities they are to do that really smartly, that benefits both, that both prepares for the next pandemic and stops this one. And that's not just a sort of like, it makes sense in theory, but there are also a handful of countries like Nigeria, like Bangladesh, like India, that have proved this on TB in particular.
Thank you, Joanne and Colin. Could you further elaborate on MDRTB? Joel and Sylvia wrote in, more than 10 years ago, they noted that World Health Organization was calling for modest increases in funding to combat MDRTB, though that would clearly not be enough. What's the status of the fight now against MDRTB?
I mean, I would say some of the good news is that we've moved to a testing protocol, like where we're saying that if we're going to successfully tackle TB, then everybody has to be tested with quality, rapid molecular diagnostics. And Colin just talked about how USAID worked with us to drive down the price of that by like another 30%. And we're going to like continue the pressure and also bring in more diagnostic tools. Now, what's important about that is with those tools, you can immediately tell at least whether someone has drug resistance. So there's ways now that we are becoming more rapid and that the costs are going down for some of that. There also are new drug regimens that are shorter and safer, but also where there's aggressive work going on to drive down the prices. So that is to say that this is getting less expensive. It takes less time. I mean, the most important thing is people are getting cured. They are not suffering horrible side effects, but also it's getting faster. It's not cheap, but it's getting cheaper to do this. And also, if we have shorter regimens for drug-sensitive TB, shorter, easier regimens to take, then we create less drug resistance. So it's both of those things. But your point is right. It is going to cost, it's not modest. I mean, it's going to cost money to reach everybody, and it's going to cost a significant pool of money to reach people with drug-resistant TB. But in the greater scheme of things, on even on the COVID response or something, it's not that much money. But absolutely, we have to invest in better drugs and cheaper drugs, better diagnostics and cheaper diagnostics, and to really fully scale this. But we do have some of those tools that are better, some of those tools that are cheaper, and it's still going to, we shouldn't pretend this isn't going to cost money, but it's going to cost so much less, not only in lives and suffering and health and people not pushed into poverty, but actually medical costs if we stop drug-resistant TB and we treat it, rather than letting it spread, because it is, in terms of antimicrobial resistance, it is a big part of that, and it is the one that is airborne and infectious, and we can stop it. But Colin, anything else that you would say about that?
The two small things, and I agree with everything there. One, I mean, fundamental to the question about 10 years ago when there was a call for modest scale up of funding, that problem of the lack of ambition and people saying it's too expensive, it's too hard, we can't do that much more, that I think is finally starting to break. And in this UN political declaration, it essentially calls for reaching everyone with drug-resistant TB treatment. As Joanne said, we don't have the money to do that yet, but we're no longer saying we don't have the money, therefore we shouldn't, or therefore we can't. We're saying we have to, and now we need to go out and find the money to do it. And I think that's a really powerful and important reversal. And USAID themselves, they released this bold new strategy last fall, which the legislation that we're working on would sort of like codify that strategy. And that strategy has 90-90-90 targets, meaning each one of those refers to 90% of the total. And one of those 90% is 90% of people with drug-resistant tuberculosis are successfully on treatment. So that sort of level of ambition has changed dramatically.
Thank you. I'm going to try to get 3 more questions in front of the two of you in our next 6 minutes, just to give you a sense of pacing.
Okay.
Yvonne Wyborny wrote in before today's webinar to ask if you'd speak on some of the new developments in testing and treating TB. And Eloise Sutherland has asked about recent reports that drug companies have dropped research for a TB vaccine when they discovered the new technology would work for a shingles vaccine, a vaccine that would earn them more money. Could you reflect further on the new developments in testing and treatment now, as well as this challenge of driving funding to research TB, a disease so often associated with poverty?
I mean, maybe on that last point, it's horrifying and tragic, and a reminder of why the kind of public sector government leadership is so important on this issue. We don't decide what private research companies decide to invest in, but the government can help incentivize the right kind of research. And that's one of the things that USAID uses a relatively modest research budget to prioritize is tools, treatments, responses to TB that are going to be effective for the lowest income, most marginalized communities. So I think to me, it's both frustrating and disappointment and an indictment of where we are on tuberculosis and a reminder of why advocacy is so important. And I mean, a couple of the things that are in the pipeline and I think are really exciting. There's another vaccine candidate that has just moved onto the next stage of clinical trials that got a big funding injection from philanthropy maybe 4 months ago. There are interesting new things being rolled out at a local level, like using AI to read X-rays. So you could take a cell phone photo of a chest X-ray and use an AI tool to diagnose TB. There are new treatments already that are much shorter, much easier to take, many fewer side effects that make getting cured of TB much more possible. So there's some really powerful innovations and lots of creative thinking about, like, what would it look like to have a TB test that, you know, is as simple as like a pregnancy test or a COVID test. And folks are doing the scientific research right now to figure that out. And was there a third question that I missed?
No, that was perfect. I have 2 questions for you now, and then still hopefully time for one more if we can. John Hornby and Dr. Paradin have written asking about how TB is handled in specific situations. John asks, can you expand on Kenya's remarkable reduction in TB? What makes them unique, or what are they doing differently? And Dr. Paradin asks how TB programs are being handled in countries with crisis, such as displaced persons and wars.
So on, maybe to start on the Dr. Paradin's question, one of the other announcements that I actually didn't share from the high-level meeting from the US is that it is going to increase its support to TB programs in conflict settings. So I know they were talking about new funding in Burma, in Afghanistan, in Ukraine. So that is an area they're leaning in. There is way more needed given the particular challenges of folks who are being forced to migrate in the context of conflict. Powerful work by both groups like MSF and other sort of emergency mechanisms, as well as trying to figure out through groups like USAID how you support government health services in a really challenging setting as well.
And I am not as familiar in detail specifically on Kenya, but I think I could say some things about what is the set of things that countries are doing in particular that I think are making like really leaps in progress. So one is, using the newer molecular diagnostics so that you can diagnose somebody and figure out very rapidly if they have TB. And then also they're even using, India and others were using like a COVID and TB platform, and others are using kind of like a multiple platform. Come in, maybe you're not even coming in because you think you have TB, but you're coming in for a cough or you're coming in for something else, and you can get diagnosed. They're doing active case finding. They're actively going out and finding people. And more in a number of countries that they're building out the strategies where you treat household contacts. Maybe you don't treat everybody, but you treat household contacts, particularly kids, but others in the family, so that they don't develop TB. Really amazing research, which we don't have time to get into, about giving nutrition packages to families, like good nutrition, because this is a disease of poverty as well. And those nutrition packages have both reduced the deaths, but they've also reduced like people in the family who've been exposed getting TB. Like it doesn't, it's not rocket science. Like if people are healthier and they actually are not undernourished, they're not as likely to get sick. So things that make multiple benefits for people, but that kind of active case finding, treating the most vulnerable contacts, really tracking the data, countries and communities, and, creating kind of healthy competition, but also seeing like why somebody's making progress and somebody else isn't. It actually creates really ways of peer-to-peer learning about what's working in one district that isn't another. And some of the stuff is really about the communities too, like community-based monitoring, like communities being a part of this and really monitoring if the drugs are not being stocked out, if the drugs are there, if people actually can access treatment when they go to a clinic. So it's that's been really important. And also in many countries, working like the public sector, also working with the private sector, because so many people go there for healthcare, to make sure that people are getting quality treatment. And even in places like India, you can go to the private sector. If you're diagnosed with TB, the government will provide you free drugs. So you can still go to your doctor, but you get those free drugs. And so there's a whole bunch of ways, that we're learning around the world, and not everything is exactly the same, that really can turbocharge what you can do to really scale up the response to reduce both deaths and disease.
Thank you both. I realize we're at time, and if folks have to go, thank you so much for joining us. If anyone has a few, maybe 2 more minutes, I'd love maybe 1-sentence answer from each of you on our final question. The question is, what is your vision of what results could make possible in the world over the next 1 to 3 years in relation to TB and beyond? What's needed in order for results to be able to drive that kind of impact?
Colin, you want to go first?
I mean, so I would say 2 things. One is that, I mean, it is the quote that Joanne shared from the president of the General Assembly about, like, we put a person on the moon, why have we not done this? And I think that is results' specialty, is helping people who have the influence and power to make a difference to realize that they can and that they should. And so I think leveraging this moment to influence the US government, but then also supporting our partners in the ways that they want and look for, to support that kind of ambition and action globally as well, among policymakers who we know have the tools to do what's needed, but sometimes need the motivation. And I think that motivation is our specialty.
And I'm going to do the same. I'm going to say 2. I mean, one is that countries have been ambitious and resilient, and healthcare workers have been ambitious and resilient. And like, the resources that we can help mobilize and with our partners around the world will be so essential to sustaining and even further increasing that, so that we can actually reach all of those 45 million people, in the next 4 years, or the next 5 years, the next 6 years. And really end this as I believe we can really do it, end this as an epidemic. We're not going to get rid of it altogether, but it is, it is political will, and it is those resources, and it is smart use of those resources. And the other thing is, I believe tuberculosis, as an equity issue, as an issue of immense health impact, when we do this right, can be the leading edge of a health equity agenda, and can be the leading edge of building out a primary healthcare system, along with things like vaccines and other priorities, that reaches everybody. And for me, the vision of TB is melded with that vision of, like, basic nutrition access. It's vaccines, it's other things that people need and deserve, and that everybody should have, and is building out a primary healthcare system that is effective and impactful and equitable, because it reaches everybody. And TB is a key part of that, and one leading edge. And that's my vision of what we work to deliver with our partners around the world in the next few years.
Thank you both. We really appreciate all this time, and I'll turn it back over to you, Joanne, to close us out. Thank you for our participants who were able to stay on a few extra minutes to hear that.
And so a thank you to Colin, a thanks to all of the audience, a thanks to Melissa and Leslie and Deborah and Matt behind the scenes, that have all been like working on this and made this this webinar possible. And really, again, just a huge thanks and immense gratitude to everyone listening who supported Results work with your generous donations, as well as your advocacy. Again, countries were bold and ambitious, and we will either help them sustain this with resources, so that ambition doesn't fade. And we have a chance to do that. And our advocacy is critical to protect these life-saving and life-changing programs that leverage hundreds of millions of dollars and help save millions of lives and futures. And truly, your support makes that possible. So as well as your advocacy, many of you. So thank you again for being part of this community that is joined up with the global community and making such an immense difference. Thanks for being with us.
Everybody.